Welcome to Medcast. Here we delve into the latest breakthroughs in medicine, equipping you with knowledge that can enhance your health and well-being in day-to-day life. My name is Dr. Wafaa Faysal. I am a consultant pediatrician in Dubai, and our guest for today is a very big name in the world of plastic surgery. He is Dr. Maurizio Viel, who is a plastic surgeon at the Cornerstone Clinic at the Grosvenor House Hotel. Dr. Maurizio, welcome to Medcast.
Thank you very much, Wafaa, for allowing me to be here today. It's a pleasure and honor to be here with you. And let's talk. Let's see what we can explain to our audience the best, the newest technique and the safest way to approach plastic surgery.
Very true. The honor is ours, first of all. And the pleasure is mine, really, because you are one of the biggest names in the world of plastic surgery. And whether we like it or no, now plastic surgery is everywhere. So, it has reached every house, if we can say. And there is a lot to speak and to discuss in this field. But before anything, I want to know a little bit about your journey. What brought you to the field of plastic surgery? How did all this start?
It started a few years ago when I was a medical student in Milano, the University of Milano, because I'm Italian. And working there, studying there in the medical school, I realized that what was important for me is to improve the well-being and the quality of life of the patient. So what was the choice? So it was plastic surgery. So then I went into the field of plastic surgery. I did my specialization. And then in 1990, I wanted to have more training on aesthetic plastic surgery, on the cosmetic side. So I went to London to do a 6-month fellowship in aesthetic plastic surgery. And after that, I like London. And I say, okay, I want to stay in London. So I stayed there in London until 2008, when instead I came to Dubai before in 2005. I like Dubai. And this time around, I said, I want to be in Dubai. So
we are lucky. We are lucky to have you
I'm
here.
the lucky one.
Yes.
So in 2008, we opened the first clinic called the London Center for Aesthetic Surgery in Dubai Healthcare City. And everything started. Yeah. And we have a great journey here in Dubai. Then my family grew up here in Dubai. I have 4 children born here. And, Dubai became a home. Yeah. And 2.5 years ago, we opened the new clinic at the Grosvenor House Hotel called Cornerstone Clinic. That is a polyclinic that also is involved in the regenerative side and also in the longevity side of the plastic surgery. So it's more comprehensive, together with the vascular surgeon, dentist, and also family doctor. So it's a full comprehensive clinic, but focused on the well-being of men and women.
Yes. Thank you very much. I visited your both clinics, the previous one and the new one, and they are both very beautiful and relaxing, and you feel you want to be there each and every time you go.
Thank you.
So I will start by asking you, how has the field of plastic surgery evolved over the years, and especially now with the influence of social media?
Yeah, Wafaa, this is a very important question because, technology drive also our specialty, but not necessarily the new technology that come out on the market and they're available for the patient, for the surgeon, for the doctor are good or the best. So the doctor, the surgeon also has the important aspect to evaluate and to see what is really effective and what is really safe in terms of new technology and new trend. But saying that, there's been on the market recently quite important innovation. But first of all, I would like to say that innovation is important, technology is important, but who works, who move, who actually activate this technology is still the doctor.
Thankfully.
It's still the doctor, it's still the knowledge of the doctor.
Exactly.
His understanding.
The wisdom.
The wisdom of the
over
doctor.
the years of experience.
And also is a manual skill.
Yes.
So you can have, as I'm always make an example, you can have the most powerful car at your disposal, but if you know how to drive, it's useless. So again, also with this new technology that coming up so frequently in the market, if the doctor doesn't know how to use them, he doesn't have a good knowledge of the anatomy, the physiology, or how the body works, they are absolutely useless and dangerous.
Very true. So, how do you find the influence of social media in the field of plastic surgery, particularly?
Social media is important because it's a good tool to try to promote a practice and to promote us,
Yes.
as a practice, as a doctor, as a person itself. But unfortunately, also in social media, a lot sometimes is not totally correct, totally true, because, it's difficult to say that's perfectly correct, that's right, that's what actually happened. So social media is a good vehicle that can help to create more awareness among the audience, but also the audience that they need to take that with a piece of salt.
Right.
And then when you go to the doctor, explain to the doctor what you want, and also listen to the doctor, to the specialist, all the information that you acquire through social media to see if they are feasible for you, if they are safe, if they are correct one for you. So at the end of the day, we doctor, surgeon, we have to have the last word on what is right for our patient. We cannot be driven by the social media on what to do to our patient.
Exactly.
But social media is extremely important, and I like the fact that it is around, but we need to use it properly.
So, absolutely right. And people also can have unrealistic expectations from social media. There is a role for the plastic surgeon to speak to them and to discuss to them and explain the reality, especially with the presence of filters and everything. So, yeah, they have many roles to play, not only the surgical part.
Yeah, in fact, nowadays with the patient, we need to spend more time. And to me, it's something that is very important when a new patient comes for consultation, that I like to listen to the patient, what they have to say. And also sometimes, yes, they come now with some idea because they see in social media. So listen carefully and then explain in a simple and easy way what can be achieved, what can be done. But we need to be there with the patient or hold our patient hand to this journey, because it's a journey that ideally should last a long time. And then this patient should be with us for quite some time. So it's a journey that the two of us, the doctor and the patient, they should take together.
Very true. Very nice. What is the most common surgical procedure in Dubai?
But here in Dubai, the most surgical procedure
The
definitely
most wanted one.
they are body reshaping,
Okay.
mainly with liposuction,
Yes.
and also breast augmentation on the surgical side. If we go on the non-surgical side, there are all the neuromodulators, Botox, Dysport,
Yes.
together with the filler and the chemical pills. But neuromodulators, Botox, Dysport, and the filler are the most common. And then there are all the new type of biostimulator that also increase the collagen formation. So these are the most important aspects in the surgical and non-surgical.
Yes. Coming to body contouring, or what they call also mommy makeover. So I hear about it a lot, especially I deal with the moms, most of the time. So tell us more about this procedure, like the good things about it, side effects or drawbacks or complications probably. In short, because
mommy makeover
many want to
is
listen
very,
up.
it's very popular.
Yes.
And basically, you are target two areas of the body with mommy makeover. One is the breast, and the other one is the abdomen. These are the two main areas, and then the operation can be done together. Usually, when we're talking about mommy makeover, what we do is a lipoabdominoplasty. So we reshape the whole abdomen, midriff of the body through liposuction and tummy tuck. And then we go to the breast, where we can do or breast augmentation or a breast uplift with implants. So when you do a mommy makeover, we join these two operations mainly together. It's quite a long operation, can take 4 or 5 hours. So the recovery time is also a little bit longer than on a single operation. So to me, it's important that when a patient decides to go for a mommy makeover, doing this operation combined to reshape the whole body has to be in a good shape in terms of health-wise. So don't rush into the mommy makeover because you need to go to right shape as soon as possible. Take your time, lose the baby
Extra
fat.
maybe fat, yes. Around the pregnancy.
Don't rush into it. And regain also the strength. And then when you regain the strength, you lose all the additional weight that you carry during the pregnancy, that come to us, and then we can do a great job. I love, for example, these two procedures, the lipoabdominoplasty and breast augmentation, because they are operations that can really change dramatically the way that you look at yourself. and they can improve the self-esteem dramatically to our patient, to our new mommy.
Yes.
But it's important to do it at the right time.
Yes. When is the ideal time, let's say?
Whenever, you reach the right weight that you had before, whenever also your baby allowed you to sleep properly, that you don't need to wake up in the middle of the night, or here in Dubai, if you have some also support at home that they can take over this side of the mommy,
thankfully.
that is okay. So you need to find a time where you're not too stressed and where you can take time for yourself and not only for the baby or for your husband on the other side.
True. Does the mode of delivery, cesarean section or normal vaginal delivery, affect the timing of this procedure?
No, in my opinion, no.
It doesn't affect.
No.
Okay. And how much is the duration for the recovery from this procedure? If all went well, let's say no complications.
If the mommy makeover, if you do it together, talking about these two procedures, I will say most probably around a month.
A month.
Yeah.
To be fully back to normal.
Yeah, to go out and enjoy your life again.
They can go back to the gym?
Yes, after a month they can go back to the gym.
Oh, great. And
depends also, how you do also, especially the lipoabdominoplasty. If you do in the right way, then after a month you can go back to the gym as well. That has to be done properly.
Yes.
And that's again goes also where to go.
Exactly. The choice of the surgeon really is very important in all the surgical procedures, but particularly I think plastic surgery, the choice of the surgeon is very, very important.
Yes, I mean...
because you are doing something to improve. You don't want to end with going back.
And especially here in Dubai, there are so many clinics that are offering this type of procedures.
And there can be people who are specialized in it more than others.
Usually word of mouth is the most important. If you hear a patient, you keep hearing about the one name that comes so often. So that is a good sign, in my opinion. Someone that comes from nowhere, just arrive a little bit, you don't know the history, so be careful.
Exactly.
And then something that also is important, don't go for the most discounted price, because you're doing something with your health, with your body. So you can save money when you buy a car, or maybe you don't buy a handbag or another pair of shoes. But they don't save money when you go for procedure that involve your health and your body, because that's not the right approach.
Great words, really. Never compromise something related to health for price or anything else.
Yeah.
So little bit, if there will be complications, like, we know this in medicine in general.
Of course. So
what are the common ones?
Also the patient is important when he does a consultation with the surgeon. They should also ask a doctor, if there is a complication, how do we manage that? So the patient immediately has an understanding if the doctor, the surgeon, is honest and he knows how to deal with the complication. Because every surgeon, every doctor, they have sooner or later some minor complication or major complication. But we need to know how to manage them and to be honest with the patient. So that is important for the patient also to understand and to have an acknowledgement of what can go wrong. And the doctor has to give the information about it and point out what are the possible complications of each individual operations. And then the doctor has to be compassionate and listen to the patient and be there for the patient all the time.
Exactly. Thank you very much for this great information. So moving on to the non-surgical procedures that everyone is doing right now, the Botox and the fillers. How do you see, are people overdoing these things? Does it happen that you can ask people not to do certain procedures that are coming for? How do you find the demand on these non-surgical? Because I think that the people find them easy.
Yeah, this is a very, how can I say, trouble field, because, if you think about filler, neurotoxin, it's just injection. So a lot of things, patient and also a practitioner, I think that is very simple, very easy, but it's not. Because you do something that can transform, can change the way that you look. And you're talking about the face, you're talking about your forehead, your eyes, your mouth, everything. So it's not something that you can take so lightly. And unfortunately, I see that here, especially in this part of the world, there is the tendency to overdo, to overcorrect. So we lose that normal anatomy. We lose the proportion that there should be there between the upper, the mid, and the lower face. Everything has to be going into proportions. So you need to keep that and make something that look in harmony with all the different parts of the face. Because if I do something, for example, in this area here, it will affect the rest of my face. So it's better to take step by step. Don't go straight away with a lot of injection, with a lot of filler to overcorrect, overdo. Explain the patient, put forward a plan. Okay, today we can do, for example, this area and this area. Then come back in 2 weeks' time. Let's see how it goes. And then we add something else. That's my approach, to take a simple, step by step, because to overcorrect, overdo is not right. From the patient point of view, it's also important to know that especially the filler that we're using nowadays, the HA, hyaluronic acid, they're all reversible. So if you don't like the result, you can reverse them, you can dissolve them very easily. So that's something that for the patient is a peace of mind. But also, try not to take step by step, as I said. Don't
overdo.
Don't inject
That's a big advice from
10
you, Dr.
syringes
Maurizio.
in one go.
Yes.
Because also financially it's quite expensive.
Yes.
So we need to look at the aesthetic, maintain the harmony, the proportion of the face, and also think about the wallet of the patient. Because, it could be a little bit
I think
too
this is a big
much.
advice for all those who are listening to this podcast, men and women, that not to overdo the things and to take it step by step for many reasons. So this is part of the culture, or the cultural effect, that people want to fix things a bit quickly or overdo things. Other things that can affect like any cultural differences you see here in the Middle East, for example, than Europe, other than wanting to do more and correct more.
The main difference that I see, because also remember my experience of 19 years in London.
Yes, what's the difference between
Is
the
that,
patients there and here in our region?
Here in the Middle East, we like a little bit more fat. Instead, in the Western world, in Europe, they don't like fat at all. Here, still, we like a little bit more curves, so that instead in Europe they don't like very much. Here is more popular, for example,
in the United States also they like curves now, because of the new influencers.
Latina.
Yes.
But in fact, here we do quite a lot, this buttocks augmentation, where we reshape the buttock through liposuction and fat injection. That in Europe they're not so common. And I personally think that is important to maintain and respect also the fat, the tissue, the fat that is under our skin. And I always say to my patient, and when I say that, they always look at me strange. When we reach a certain age, fat is your best friend.
Right.
Because that's what keeps your skin looking younger. That's what keeps your skin, your body still firm and toned. If you remove all the fat, it becomes older. And that's something that I also...
You gave me this advice one time.
Yeah,
I remember. Yes.
I always said that.
Yes.
And that's also something that brings another subject into the discussion. That there are now a lot of people that are abusing this peptide, Ozempic and Mounjaro, to lose weight. Because that is absolutely... It's okay that the drug itself, if you're overweight and if you want to lose weight and improve also the cardiovascular system. But you cannot use these drugs if you want to lose 3, 4, or 5 kilos.
Exactly.
That is a shortcut that brings only side effect, because he will look at the end older. The skin, he will lose all this elasticity and the support.
We get more patients then.
Yeah, and then
Yes,
they come
to the plastic surgeon.
Yeah, they come with the Ozempic face, because everything fall down.
Yes.
And also the skin quality change. Because the volume loss is so fast, so quickly, that the skin doesn't have time to restore itself.
Yeah.
So that's something that I need
Very
the patient to be aware. Don't take shortcut. Because at the end of the day, to lose 4 or 5 kilos, you can lose it very easily with lifestyle. Because the point is that the lifestyle is what is important.
We're coming there in the end, yes. This
Okay.
we're coming there. So now I want to ask you something like the natural beauty concept, natural beauty concept. Does it still apply in this modern world?
But I personally, I feel that has to be always there. Because
Yes.
as I said earlier, the face, especially the face, is made of proportion and harmony. If we disrupt that, we don't look good.
Yeah.
And also, it's important to maintain the individuality of each person, of each face. We cannot create an image that they look exactly the same one after the other. You are beautiful because what you are.
The
Your
uniqueness.
proportion, the uniqueness,
Exactly.
correct.
Yes.
So that's also what we need to keep in mind when we see patients
Yes.
that are coming to us to say, I want to look younger, I want to look better, fine. But we don't want to do a full transformation.
Yes. Maybe some work on the self-esteem also of the people can help them sometimes, not to overdo things.
It's
can be-
education, Wafaa. We need to
education,
educate
yes.
the patient.
Yes.
We need to, as I said, we need to be in charge.
Yes.
And not the Google or social media.
Yeah,
then
or
to
just
be in
think
charge,
about the money at the end or the profit. So it's, the health of people is involved.
We are doctors first.
Yeah,
all.
we are
not,
doctors.
We are not business people.
Exactly.
Wafaa.
Very true. Very
you know that
true.
very well. Me and you, we know
Yes,
each other for
yes.
quite some time, and we think
Yes.
exactly the same.
Yes, this is the way it should be. There is a question from my side. Like in the past, liposuction was a bit quite of a dangerous procedure. Not because of the procedure itself, but because of the effect of the anesthesia on the patient. So is it still the same nowadays or anything?
But I dare to say that for me, liposuction is one of the safest procedure if it's done correctly.
Yeah.
So the surgeon needs to know what is he doing. The anesthetist has to know exactly how to balance the fluid into the body. And ideally, the liposuction should be done under sedation and not general anesthesia. And don't remove too much in one go.
Okay.
And then it's perfectly safe. Yes. But again, the surgeon that does the operation has to have a proper training. You cannot invent yourself to start doing liposuction only with 1 hour training. You need to know the anatomy. You need to know exactly very well how to do it. It is a learning curve that takes time. But if it's done correctly, liposuction is absolutely safe. But let me say something that is important that to remind the patient. Liposuction is not for losing weight. It's for body reshaping. And that is an excellent tool because we can reshape the body. In the past, it was called liposculpture because actually what it is, we are sculpturing the body. And that's what liposuction is all about. And there are different techniques that you can use, technology that can use to make the experience even better. But at the end of the day, are the hand and the mind of the surgeon that control this technology, as we said at the beginning. So we need to plan properly our surgery according to the proportion, the harmony, and what we want to achieve.
Amazing. There are some procedures that are common between plastic surgeons and dermatologists. Do you have any word on this? Which do you advise us to go to a plastic surgeon or a dermatologist, for example, for certain procedures in the face?
But dermatologists do a great job when you're talking about facial sculpturing, where they use a lot of filler and neurotoxin and biostimulator because they are working on the skin. Mm-hmm. So if there is a dermatologist, I'm very happy for them to do that because that's what they're also there.
Yes, they're doing right now.
They're doing it,
yes.
And some of them I know the personally they're excellent.
Yes, they're excellent. True. Now I'm coming to this part of lifestyle, as you were mentioning, or longevity. The science of longevity is more and more now on the surface, and we are all full of hope. Let's say that really we can reach this point. And they are telling us that they have reached this point, many longevity clinics are opening nowadays, and some good research has been done, and we knew some facts about the blood sugar and how it affects the cells, cell aging. And they ended up so far with three more most important things that can keep the people younger for longer, which are all related to the lifestyle. So the diet, the exercise, and the sleep.
Yes, this
Yes.
is a very hot topic at
Yes,
the moment.
very, very hot topic at the
And
moment.
I love longevity.
Yes,
Of course,
and your
everybody
clinic
does.
deals with
Yeah, we do
longevity
also. Yeah,
treatments.
correct.
Yes.
But what you said is perfectly correct. But let me tell you something that, to me, explain exactly what longevity is.
Okay.
When you're talking about longevity, we want to expand how long we live. But it's not only how long we live, but how well we live. Because if for my last 20 years of my life, okay, and for example, I hope to reach 100, but if the last 20 years are not well enough, I cannot be independent, I cannot do what I used to do before, they're useless.
True. The
So
quality.
the longer that we live has to go with how well we are going to live.
Yes.
But
That's the aim, I think, of this science.
But the key
Yes.
point, okay, that we don't have the magic pill that you take and then you will live well and long for more than 20 or 30 years. Not yet. If we want to live well and longer later on in our life, we need to start when we are young. Because when we are young, with our lifestyle, with our diet, with our exercise, that we put the foundation of how we will be later on in life. So we cannot abuse our body and when we are in our 30, 40 or early 50 and then expect to live well later on in life. We cannot do that right now. But if we start having a good, healthy lifestyle with diet and exercising and sleeping, and then we will put the foundation for us to live longer and healthier. That to me is extremely, extremely important.
Yes.
Together with another aspect that involve medicine, involve doctors, we need to focus more and more on prevention. And also the prevention, that means that we cannot delay, okay,
Yes.
the prevention. Say, okay, you're okay, take on these little tablets and you go and fine. Yeah. We need to investigate more to try to understand how we can prevent certain metabolic
diseases.
Metabolic
Yes.
disease or cardiovascular disease
Diabetes.
Much earlier than what we're doing right
Yes.
now.
Yes.
So especially the family doctor, the GP, they should investigate more and more accurately and start earlier on with preventative treatment because that will give us more credit later on in life to live longer and better.
Absolutely true. Yes, even to start in the teenage years for some metabolic diseases.
Yeah.
The prevention starts as early as the teenagers
Correct.
or adolescent years. This is great. And there are some supplements, let's say. So we are always discussing that there are some supplements and they are discovering some things that can help. What's your opinion on these supplements, whether they are injectables also or pills or...
Well, first of all, diet. If you have a healthy diet, a Mediterranean-style diet, you are in the right path. Then you can always take some supplements, but also before taking supplements, do also some blood tests to see if you have any deficiency in vitamins and minerals, and then you can also supplement properly. So I think that's the best way to do it.
Yes. And then the aesthetic touch from your side.
Oh, yes,
also.
of course.
It doesn't harm. The DNA testing, they are also doing it these days for comparing. So the future is promising.
Oh,
and
yeah.
yes, many things are happening. So how do you see the future of plastic surgery, let's say? Away from longevity now. No, but maybe hand in hand because longevity will be there.
Longevity goes very well with plastic surgery.
Exactly. And with AI and with also the technologies that are happening.
Ideally, I think that if we have a good lifestyle and a good longevity and we are healthy, also the aging side will be slow. So hopefully, we will do less invasive and less invasive treatment. Because that is, to me, what is going to be. Less knife, but more inside treatment.
Exactly. This is very nice. Dr. Maurizio, we reached the end of this podcast. What's your final message to the people?
The final message, look after yourself, eat healthy, exercise, and don't be afraid to go and see the doctor if you have any sign or that you don't feel well. And then find a good plastic surgeon or dermatologist that can look after you for many years to come, hand in hand together.
Thank you very much, Dr. Maurizio.
You're welcome. Thank you, Wafaa.
Thank you.
Thank you.